Does your cat not want to eat? Further still, do they seem to refuse water? We might observe our cat losing their appetite a little, but if they stop eating altogether, something isn't right. The causes of this behavioural change are diverse, ranging from simple problems to serious health complications, which will require treatment by a veterinary medical professional. Before we begin, it's important to recognise that the loss of appetite in cats is a clinical sign of several diseases. For this reason, it's imperative you don't ignore this behaviour and take them to the vet for diagnosis. Kittens need special attention as their immune system is weaker than that of adult cats, and they can dehydrate very quickly if they stop drinking fluids. They also tend to be more sensitive to changes in diet, so it's important to monitor their eating habits if anything in their diet changes. When a kitten does not want to eat, it's advisable to stimulate their appetite with wet food or even mixing in some water to offer extra hydration. This type of food is more palatable and is often better accepted than dry food. If a kitten has eaten nothing in 24 hours, it's a cause for concern and an emergency veterinary visit is required. Also, remember that newborn kittens need to feed between 4 and 8 times a day, so if a newborn cat has not received food in a 12-hour period, you need to go to the vet. Why does a kitten stop eating? They do not like their food. Many cats stop eating when their food changes. If you have recently modified your kitten's diet, you should check to see if they refuse food for this reason. The food is too close to their water or litter box. Although we may not recognize it, your kitten can feel uncomfortable in the home. It's very common for kittens to stop eating if their food is left too close to the litter box or their water, or simply any place which seems dirty to them. Heat. It's well known that during the summer, cats can reduce their intake of food. The heat and the fact they often sleep more in the cool shade can result in their appetites going down. Hairballs. Intestinal hairballs, known as trichobezoars, are a common cause of why cats stop eating. The hairballs form due to the accidental ingestion of dead hair from their coat during their grooming process. While it is quite a common reason for appetite loss, regular brushing and the use of malt paste can help reduce the likelihood of developing them. Poisoning. Our cats can ingest something which is toxic to them, whether it is food toxic for cats, spoiled food, or otherwise contaminated food. We should also rule out whether the feline has ingested some other poisonous substance, something which can occur in cats with outdoor access. Depression. Anxiety and stress in our feline, often caused by a traumatic incident, can lead to them losing their appetite. A change of residence, another new pet, the birth of a baby or the death of a family member may lead to our cat being depressed and losing their appetite. Various diseases. A sudden cessation in eating may be the symptom of a disease. This is why a visit to the veterinarian is mandatory. While this could be a minor problem like hairballs, it could also be something more severe such as an intestinal blockage which may require surgery. If your cat is not eating, you can look at their vital signs and also monitor them for other symptoms of disease through a physical examination. Check the mucous membranes of the cat, including the gums, eyes or anus, and if they are any other colour than the normal pale pink, it is a concern. White, blue, yellow or deep red tones are a symptom of disease. Use a digital thermometer to take your cat's temperature, which is performed rectally. It should be between 38 and 39 degrees Celsius. Take your cat's pulse with your index and middle fingers, although this may not always be easy with kittens. The heart rate should be between 140 and 200 beats per minute. Check their respiratory rate by laying your hand on their belly. Normally, cats breathe between 20 and 42 times per minute. Cats do not usually show signs of disease as evidently as in other animals, so here are some common symptoms of feline disease. If any of the vital signs of the cat are altered and you also observe symptoms of illness, don't hesitate and go to the emergency veterinarian as soon as possible. Ideally, you should call ahead to ensure they can assist you as soon as you arrive and also provide as much information as you can. The first thing to do if a cat does not want to eat or drink is to try to stimulate their appetite with tasty food, either homemade or quality canned varieties. You may know some food for which your cat has a preference, so try this out to see if preference is the issue. You can also try to warm the food a little or add in some chicken broth without salt or onion to make it more enticing. If your cat still doesn't seem to be receptive to eating, you may find you have a depressed, overheated, or even a sick kitten. In any case, if you have not been able to identify the reason why your cat is not eating anymore, call your vet to evaluate the situation. They will tell you how to proceed and will suggest the best procedure to follow for treatment.